Evening, everyone, and welcome to the AlexAndMo I am a PT podcast. Tonight, Alex and I are diverting a bit. We were scheduled to have Dr. Alexandra Merriman on our podcast tonight. However, there's good news on her end. She welcomed a baby girl into the world, and we are truly happy for her and her spouse. So, congratulations, Dr. Merriman. On Friday, the Center for Medicare Services, CMS, proposed a payment cut for home health care services. Both Alex and I are business owners in the home health settings. So this definitely will have an impact on us. So we are going to discuss that tonight. We want to thank everyone who has subscribed to our channel so far, our YouTube channel, and have been tuning into our episodes. We remain grateful for all the support that you have been showing us over the past couple months. Alex, anything you want to share?
No, just thank you. Thank you. Very thankful to everybody. Very appreciative of the support. Um, looking at our numbers on YouTube, the last couple episodes have been blowing up, and that's very awesome. And again, very thankful to everybody. When you and I started this podcast, we had wanted to have fun with it and hope to do well, but I think it's going probably far better than I thought it would initially, and so quickly. So it's very promising, very motivating to keep going and to keep putting out content for everybody, and that's being so receptive. So overall, thank you very much. Continue to support us, continue to follow us, share it with your friends, families, colleagues, whoever, man. We have a little bit of information and stuff for everybody. I feel we try to hit on stuff not just PT related, not just home health related, but just stuff in life, things that you can do on your day-to-day life, whether you're clinical or non-clinical. So yes, thank you, and appreciate the support and keep it coming.
Yes. So this week is a big week for any female who has benefited from Title IX. Um, on Thursday, it's going to be celebrating 50 years, which is about less than a decade old than how I am because I'm in my 40s. I was one of those who benefited from Title IX because I did receive an athletic scholarship to come to this country to play soccer. And that set me up to be in the position that I'm in today. And I remain truly thankful for the people who fought to allow women to be able to get scholarships to compete in college sports.
Yeah, absolutely. I mean, it's a huge point in history. And I think every year in collegiate sports, especially, the women's that stage is getting bigger, and they're up to the task, so to speak. Um, the last couple of years, the Women's College World Series in softball has been amazing. You're getting more and more of a draw. You're getting more of those dollars behind it. Uh, and ultimately, as we've known, we've discussed with the women's national soccer team and things of that nature, uh, money talks. So for these women to be given the opportunity to play at the collegiate level and go from there, but not only are they playing, like they're shining, they're bringing eyes and money and sponsors to their individual sports, and that's a huge thing for them and for all the young girls coming up, that want to have these dreams of playing in high school, college, and even some pro. It's because of the women that fought and back then and continue to fight. And I got to say, like I said, I think that I've really noticed it in women's softball at the collegiate level, how it's really taken off, and it's exciting. A couple of years ago, Florida State was in the finals, so it put me to watch, and that was pretty cool. That was a pretty cool experience to see those girls perform and have that many eyes on them. I think, if I'm not mistaken, Oklahoma went back to back this year, and uh, again, just a lot of excitement around it.
Yes, I'm glad that there is, I wouldn't say equal opportunity because it's definitely not equal, but at least it opened the doors for many to start careers on the professional setting as well. Speaking about equality and inequality, Dr. Lisa Van Hoos, and thank you for the shout out of our podcast on your Linda Woodruff lecture that was held on June 16th by the APTA. Uh, she spoke about DEI burnout and fatigue. And it's something many, no matter what your color hue is or your racial ethnicity, has expressed that, you know, it some have expressed that it's played out or they're tired of hearing about it. Um, but you and I created this podcast to bring to light some of the challenges that we face as Black and Brown clinicians. There's a motion that's going to be brought to the floor stating that we should just focus on the business of physical therapy. But businesses are run or functioned by people in it, like you and me. So if you don't want to discuss the issues that affect clinicians like Alex and I, or you don't want to discuss circumstances that affect the patients who are paying us for the services that we render, it's not it's not physical therapy. So the only thing you're concerned about is money. And this leads us into the proposed cuts that CMS has been talking about for years, because I don't think we take into fact our role in playing for the misuse, abuse, and overuse of services that have done in the past to make them feel that physical therapy is not necessary or needed. And we have a role to play in the cuts that we are getting because we didn't properly manage the gifts that we were given. And a lot of us took abuse of it. Um, we have sort of been a subservient profession for a very long time. And a lot of us still operate that way, that we don't want to take ownership of stuff. And it's about time we start doing that and stop hiding behind other professions. If you know that you own a clinic and you bill for services that you're not directly providing to a patient, that's misuse. And you can't say that CMS should pay you the actual fee for services that a skilled person is not rendering. And it is affecting everyone else in all settings. In home health, a tech cannot go to see a patient. It is a skilled licensed clinician that has to go in and provide those services. We have transportation costs rising because of increased gas prices. In Maryland, regular gas price is over $5 now, which is crazy for regular
Yeah,
gas.
yeah, we're not quite there
So
yet.
So clinicians are not going to want to drive over 10, 20 miles to go see a patient because you're going to have to fill up probably 2 to 3 times a week. Okay. Now, because of the cuts that CMS is giving to agencies, they can't account for increased wages that people are asking for. Cost of living is going up because rent is going up, housing prices are going up, inflation is going up, even the cost of groceries is going up. I just went to the grocery store and bought a few items, and I was like, look, I have to be shopping on a budget now. I can't be paying for steak and salmon anymore. So, maybe I have to live on drumsticks. Even wings is expensive. So, I
Everything's
mean, this
expensive.
this this is
You
crazy.
you leave the house, you're gonna spend 150 easy. Um, it's crazy. I mean, yeah, everything you just said. Starting off with the DEI fatigue and focusing on the business. I mean, physical therapy is people. We've got to take care of the people. We've got to take care of the people that need our services. We got to take care of the people that are providing the services, because at the end of the day, you can't have one without the other. Um, and we're getting to a point where it's getting hard for the reason you mentioned: the cost of gas, the cost of food, housing, and all those things. We're going to start to push people out to other professions. Like we've had the conversation. It's been had multiple times, social media, Twitter, and stuff, where mainly you and I interact. The return on investment, the return on the degree, the doctorate of physical therapy, is nowhere near, in my opinion, what it needs to be for the amount of time, school, money that is put into it. I was just interacting with a new grad who's interviewing uh, for a position. I think he's based out of California, and he made a comment. He's having to deny or decline job offers via email, like he's breaking up with people. And I posed the question, how many of them have been disrespectful with the money? And he just said, how much time do you have? And it's things like that that make it hard. Nobody accounts for what happens underneath the roof and four walls that everybody sleeps on at night. Like we have to take that into account. And everybody wants to cut. Everybody wants to cut. We're going to end up losing um, a lot of good clinicians, because at the end of the day, you've got to do what's best for you and your family. I mean, I'm not gonna lie. I've looked into, how can I pivot? Can I pivot? Can I make a move to do something different? Not because I don't like what I'm doing, but it's getting harder and harder. It's getting harder and harder to be able to provide, to be able to enjoy uh, my day to day life without figuring out, like, man, this is costing me a lot more than what it used to, and I can't make any more money because the way that our profession is set up, there's a reimbursement model in there, and companies don't want to pay. And now CMS is saying, hey, we're going to cut 4.2%, which I think the article you and I were discussing said it was like $8 billion or something like
Actually,
that. Like,
actually, yeah, it's a lot.
so it's
Um,
it's just like, how, what, how you and I, we do things as business owners. We go to these agencies and we propose what we feel is fair and worth our time and effort. But now they're going to start cutting that, and as we all know, is all it takes is one person says, I'm gonna do that, I'll do it for cheaper. Well, and then that one person just messes it up for everybody, because they're like, well, I'm not going to pay you. Jimmy down the street said he going to do it for less. Right.
and
So then,
that affects quality of service because less is not always best. And who is going to be on the shitty end of the stick? It's a patient.
it, and at the same time, like, you've got the good clinicians that are going to get burned out. You got the good clinicians that are going to get burned out because they're having to work longer, harder to break even if they're lucky. And
If
so
they're
then,
lucky.
and then at that point, you're like, why am I doing this? why am I doing this? You know, being completely transparent, I've had a very rough last week and a half professionally, just working and stuff. Like, it's just been very busy to the point where it's just exhausting. And you're like, man, like, this has only been like a week and a half. There's people that are working like this every day. I'm like, I can't do this every day, you know? And when you start getting cuts, both from all kind of sides, from the business side, from CMS side, that's all excuse me. That's what you that's what you're leading to, is that burnout. And people are just going to say, you know what? I'm just going to go in a different direction. And then it'll be like, well, now we don't have home health clinicians. You know, I feel like outpatient has been going in that route for several years because their reimbursement rates have been getting cut and cut and cut. The majority of physical therapy people want to work in outpatient. I mean, I see job postings here in Florida talking about full time 60 grand. I'm like, 60 grand? I can go do something else that doesn't require me to have a doctorate and 7 years of school and make 60 grand, not to mention the student debt.
Yep. So then, if reimbursement is going to get cut almost every other year, then what's left for us to really do? You're talking about making a pivot. Trust me, that has crossed my mind, especially when I was going through the weeks of the illness that I had. And people, take care of yourself. Don't work yourself to the fact that your body is getting so fatigued that you keep pushing yourself and trying to be resilient, and it shuts down on you. So you don't want to be in that position ever. So I have also thought about, okay, what avenue is there? So even putting my business in a position to sell, but who is going to want to purchase a business if the payments are going to keep declining and cost of living is going to be going up and people are going to be wanting more money? That's just going to cut in to your profit margins. So you have to think of other ways to make money. You think about consulting, but who's going to want to pay for consulting when it's not really going to be getting them more money for direct services? We hear gurus talking about not trading your time for money. So, but most people are not in the position to all be consultants or all be teachers and instructors. So they have to see patients directly because that's why you went to school. And that's what physical therapy pretty much is. So, what choices do you have after spending 7 years in school, possibly doing a residency? Because a lot of people want to have that extra alphabet behind the DPT. What choices do they have?
Yeah, I don't know. It's definitely something that's very challenging. You know, my wife and I were discussing. You know, we've been doing things kind of the same way for a while, and that always work. But with the nature, the economic nature of our society right now, and the way things are, you know, we have to start getting creative into how we're doing things, right? And you know, somebody asked, you know, on Twitter a couple of days ago about, you know, how trying to remember the exact wording, but basically, how happy are you as a physical therapist right now, and you know, why do you feel that way? And it was like somewhat happy, very happy, not happy, you know. And it's tough because I enjoy doing what I do. I enjoy helping people, but it's getting harder. It's getting harder to to make ends meet. And as much as we get into this, and you and I have talked, we didn't get into this because I mean, we got bills to pay. We got people that rely on us. I got a wife and two kids. I got to take care of them. And with proposed cuts, because now again, it's like they say, the trickle down. So the agency now gets less money, so they're going to want to turn around and pay you less money.
They may not even want to use, honestly, thinking from a management perspective, they would want to employ their own people because it's going to cost them less than to pay for contractors like you and I.
Yeah.
So that will eventually reduce the amount of jobs that you and I will have. They are also gonna lay people off like they did when the PDGM came down. So that's gonna be another massive job loss for physical therapists. And that didn't go over well when that happened prior to COVID. And you'd think that after COVID, the value of physical therapy would have increased, um, because the role we had to play during the pandemic, but it doesn't seem like it. And this is not the best time to be losing a job.
No, absolutely not. Absolutely not. And obviously being in healthcare as a physical therapist, I like to think that, you'll always have a job. Um, the bigger question, in my opinion, is will you need one job? Will you need two jobs? Will you need three jobs? Uh, to make your numbers work for your situation. Um, it's concerning. It's concerning. I mean, we'd be. I feel like we'd be lying if we were just painting this rosy picture, like everything is good all the time. As some people do. That Instagram filter life, but we a safe space here for us to be real, and to be real is like it's concerning. It's concerning uh, for the future of home health, physical therapy, for the future of home health in general, uh, because physical therapy is a huge player in the home health world. It's a huge player. Um, you know, I would say that outside of like IVs, probably more in-depth wound care, and some therapists are amazing wound therapists, so I'm not going to disregard them, and by no means am I putting down nurses, but uh, we can do a lot of things for a patient on a huge scope of meeting their needs in their home, right? So when you start to threaten that, where do we go? Where do we go? Because it used to be like, oh, if you were an outpatient, oh, if you go to rehab or you go to skilled nursing, you can make more money. Right? Then it was like, okay, go to home health. Well, now they're trying to cut that. We already know that outpatient is really not anywhere that you can make money. And again, to make it very clear for everybody, we did not get into this to be millionaires. We're fully aware of that. But
well, we have to keep it real. As you said, bills have to be paid.
But we got bills to pay.
Mouths have to be fed.
When I came out of PT school, I was single. I only had to account for one person. That was me. So I could go do an outpatient, which I did, and I loved every minute of it. And then it just got to the point where I was like, this money don't make sense. So let's try to move, and that's how I progressed. But even now at my point, I'm like, okay, let's try to stay 1 or 2 steps ahead of the game as best I can to try to account for stuff. But it's getting tough. It's getting tough to kind of get everything lined up and do things the way that you were probably doing it, 1, 2, 3 years ago. It is getting tougher. It's getting tougher. So it'll be interesting to see, like, I know they open it up to like a public comment period, and people can make comments. So home health clinicians, be vocal, be vocal. Let them know how this is going to affect your patients, how it's going to affect you, and how it's going to affect your ability to provide that care. Because if they're going to cut payments, but cost of gas is more, those patients, like you mentioned, like, hey, Alex, I need you to go see this patient. It's 20, 30 minutes away. I'm like, I'm good. I can't afford it. It's costing me less in time than what you're paying me for the visit, you know? And it just leads people to start cutting more corners. Because if we're being real, we're already cutting corners. Everybody cuts corners wherever they can. But now you making it more almost required to cut those corners because you can't make it work any other way. Um,
Because
so
the demands aren't going to change because Oasis E is coming out.
yeah,
So that's increased documentation requirements, and clinicians are not going to be happy about it.
and and
Definitely.
and and more and more people want to be home. I mean, especially with COVID, you had people that were like, I'm not going to a nursing home. I'm not going to a facility. Like, look what's going on over there. Send me home. I want to go home. Right. So,
Well, and with more people wanting to be home, honestly, since you mentioned that we do so much more in the home health setting, like we reduce a lot of costs for Medicare by preventing falls and having people going to the hospital for readmission. We save them a lot of money. But I'm wondering if, as a profession, if we collect enough data to support that evidence that we already know, that we already see. Is there data there that, besides just commenting on the proposal to say that it's going to be bad or make home health unstable, because nurses can't do what we do the same way sometimes we can't do what the nurses do. I
absolutely not.
definitely don't like wound care, so I'm not going to be doing wound care. I'll do the basic stuff like remove staples and stuff after surgery, but the other stuff, no, I'm not packing wounds.
Yeah. Now I'm with you.
But um but we do save Medicare a lot of money. And if they want to talk about health disparity and increasing access to care, there are a lot of physical therapists that could go to areas that they have a shortage of nurses in. And since we are also skilled in doing oyster start of care, if they're short on nurses, have the doctors write an order for the physical therapist to go there and do the start of care, and then nursing follows. I mean, it's just that simple. Those are ways to adapt. But
And
if
and
cost,
and, and that's happening around here. I
yeah,
mean,
if
I'm getting a ton of
start of cares,
nurse a ton of startup cares because nursing was ordered. They don't have a nurse. Like, we need PT to do it, and then we'll try to get a nurse in afterwards. Yeah, it's happening. It's happening, but you've got some of these bigger hospital systems here that, as it is, are operating negative. You know, so how you cut more of their money, now they're further in the negative. Where do you think they're going to recover or to attempt to recover? They're going to
yes,
go to clinicians. I mean, the upper management ain't taking a pay cut, so it's easy to go after the clinicians, who oddly enough are the ones that bring in the money. But that's where you're going to go. And I think, to your earlier point, as a whole, I feel like our profession has always been, at the kid table at Thanksgiving instead of sitting with the grown-ups, right?
very true.
So when we are treated as such, are seen as such, like physical therapy, you guys go take a seat over there. You're not the big boys, and we don't speak up. Uh, some may make the argument that the APTA should probably do more. That's another topic for another day. Um, but as a profession, individuals collectively, I don't feel like we're respected enough, right? So when you don't have that respect, you're not deemed important enough to be involved in these decisions, to be involved in being thought of in these decisions. Because even if you don't get to partake in the decisions, be like, hey, I know PT's not here, but we got to keep them in mind. That doesn't happen. I mean, doctors as a whole are always going to be taken care of. They're the gatekeepers historically to medical and to access, especially with HMO plans and stuff like that. But I just think that part of the problem is we're not respected as a profession. We're not respected for what we do. Uh, and we don't have people kind of voicing their opinions for us. We always hear about the bad things about physical therapy, but we don't hear about the good things. Um, and I think those things make it harder to be taken seriously.
So, what do you think? I know you mentioned in one of our previous episodes that you are not an APTA member, um, but the home health section, what do you think we should do as a section with this proposal?
I, I think we have to, you know, as you mentioned earlier, like, do we even have data? I'm sure we have, even on a very anecdotal level, sort of numbers, figures that can at least start to paint the picture of what we do as a profession in the home health world. Um, and like you mentioned earlier, I think there was a period of time where, as a profession in home health, physical therapy was sitting at the top, and through abuse and mismanagement, it's cost skyrocketed from a Medicare standpoint, right? Like, you were getting, I've seen plans of cares where there was 30 something collective rehab services, PT, OT, and all this stuff in one cert period, right? So when you've got that times thousands, that's a lot of money going out for not necessarily should it be going out, should that client be receiving those services, right? So that abuse is what swung the pendulum completely the other way, because you used to get those P of cares 2 week 8, and then you resert them another 2 week 8, and then you resert them again in another 2 week 8, right? And now it's like, hey, it's diagnosis based, but they pivoted to try to make it a little bit more difficult, as opposed to just saying, hey, you can just do whatever you want, free all. But I feel that we've got to try to paint this picture where we show our value, where we show our significance, so that the people in power making these decisions, making these recommendations on pay cuts, can say, you know what, maybe let's hold off, or let's look into this a little deeper before we do. And I feel like in the past that has worked sometimes. They always, CMS says, we're going to propose a rule, and then I know that there's been times where, like, well, X, Y, and Z rule is going to get put on hold. We need to kind of investigate a little bit further. We need to, see what's going on. So it definitely works. But we need to get out there and voice our opinion, because if we let them start taking 4% here, 4% there, once you let them take a little bit, they're going to keep taking.
And most definitely. But to be able to get our voices heard, as you said, we have to move from the kiddie table to the grown up table. And unfortunately, especially in home health, you don't have many physical therapists in positions, in executive level positions, to argue on our behalf. So this ultimately falls back on the American Physical Therapy Association, and they say we are APTA. So I hope the other settings don't just stay on the sidelines, because if this is affecting home health, it's going to be affecting skilled nursing. It's soon going to affect acute care. It's already been affecting outpatient care. So we talk about arguing and working for the business of physical therapy. This is one of those things that definitely needs to be worked on. So
Yeah, we're at a crossroad. I feel like, um, with everything going on outside of the profession, in the world right now, and then going on within the profession. Like, I feel we're at a crossroad. Like, this can go either very well or very bad. Um, and if you're a PT student right now, I'd be paying close attention. I'd be paying real close attention because, I've been a PT now for 14 years and it doesn't even feel that long. It's just crazy how the time goes. Um, but I've been able to do pretty well for myself. But I didn't start in these conditions. Um, so to start now, as an analogy, it's almost like, that first time home buyer trying to buy a house right now. It's hard. It's hard. You got a lot of stuff going up against you. So, um, yeah, PT students, you know, staying in tune as to what is going in on what is happening in the profession right now, because when you come out, you've got to be ready to face these battles, um, because some of them are just, some PTs are on their way out, so they're just like, I did my part, or I've done my time, so to speak. I'm tapping out, and we got to try, you, me, and some others. We got to try to lift this up as best we can so that those coming in can continue to push it upwards. Um, because if not, like I said, I don't know. Like, it's definitely like I told you before. I've looked and I've thought about, you know, making a move, switching completely, how feasible that is. Because I don't feel as certain as I used to, about, you know, the profession and my ability to make a living the way that I want to make a living. And honestly, like the way that I have been, I'm not rich. I don't claim to be rich. I don't things. I live a very good life, a very blessed life, and I want to be able to do that. I want to be able to continue to do that, uh, and you know, this is a huge part of that.
I totally get it, and I'm with you. I've been pondering on stuff myself. I know you mentioned that even though certain things happened, it happened at the right time, because it gave me an opportunity to be able to help concentrate on our podcast and try to move it forward and focus on the marketing and stuff that I've been able to learn a ton, just following doctor's orders to keep my tail at home
Hmm.
and rest. So um, I've been reading books, studying stuff. So it definitely has made me more comfortable if I have to make a pivot, that I just make it and adapt as things come, and not be like, oh my gosh, I spend my entire adult life studying physical therapy, doing physical therapy, then what now?
Yeah,
So I think whatever we decide individually or collectively, it will be a good thing, because there are principles that we have that has allowed us to succeed so far in life. And as you said, we're not rich, but we've been able to live comfortably. And we would want the next generation of physical therapists to enjoy things like we've enjoyed. It's looking sort of bleak right now, but after every storm, there's a rainbow and a sunshine. So
it, it,
this
it
could
gets
just be a passing.
it gets harder before it gets easier, you know. And
Yeah,
and to your point, absolutely, I'm a man of faith. I believe strongly uh, in the man upstairs, and I know that, you know, he has plans for me. He has plans for me and you individually and collectively with what we're building here. This, to me, in my vision, is a part of my pivot. And hopefully this is something that we can continue to grow and can take us to some of the places that you and I have discussed. But everything happens for a reason. And, you know, I know that no matter what, I'm going to land on my 2 feet. It's never going to be easy. Uh, and quite frankly, I don't want it easy, because then you don't appreciate it. You don't appreciate it. When you put in the work, you appreciate it. You put in the time, you appreciate things. When things are just kind of come easily, uh, you get complacent, and you know, sometimes things happen just to kind of wake you up, just like, hey, you know, you're on cruise control. You need to come grab the steering wheel again and start doing things what you need to do. Um, and quite frankly, sometimes I feel like the last, you know, week or so, it's been probably that. Um, you know, just kind of, hey, wake up, get your stuff together, you know, get stay active, stay doing what you're doing, so that everything that has been planned and promised for me, I can still get to.
very true, very true. So I'm likewise. So as Alex and I have been encouraging you, if you're a home health clinician, what a physical therapist, nurse, occupational therapist, speech language pathologist, phlebotomist, whatever you do, if you work in a home health setting, go to the CMS website and give your comment against the proposed 4.2% cut. We don't need this right now. Um, Access to home health is needed. We also don't need our patients to suffer. Think about our population aging and everything else that's going on. We all need access to quality care. We all need to continue to get money to pay our bills, keep a roof over our head, wear clothes, and feed the mouths that we have to feed. So please go comment on the CMS website.
Absolutely. And I think this is good conversation. So for our many followers, you know, hit us up on our social media accounts, which you can find them on the scroll at the bottom, or hit us up individually, Mo or myself. Like, you know, collectively, when we interact and we have conversations, there's good things that can come from that. Good ideas, good ways to manage current situations, to way to improve situations. So please reach out to us. Let's talk. Let's have a conversation. Let me know your thoughts. Let me know what you think is good, what's not good. Alex, I like when you said this. Alex, I didn't like when you said this. You know, whatever it is, let's talk. Let's figure it out, because we need to help each other out. We need to stick together. And like you mentioned, you know, we are PT, so all of our other therapists and other um, settings, like, we need to stick together. We need to stick together. We need to help each other out so that we can all kind of lift everybody up. You know, it's like I said, when I win, we all win. So let's get those W's rolling for everybody in this profession, because at the end of the day, we do this for people, and we do this because we love helping people. And sometimes we got to help ourselves and help each other so that we can help our clients, our patients, the ones that truly need us. Uh, but yeah, reach out, help out, speak up, um, and then keep watching episodes. Keep watching episodes. We've had a lot of good stuff come through. Uh, you know, the Pride episode that we released on Friday was awesome. It was a huge learning experience for me. And thank you to all those guests that we had on, who were felt safe and vulnerable to share their stories, to share their interactions, and to teach us how we can continue to help and how we can continue to do that. We had an episode with Dr. Rebecca on the emergency department. That got my wheels spinning. I talk about pivot. That's probably one thing I'd like to look into further. So check that episode out. We got some oldies but goodies with Jerry, Nick. Uh, what else am I missing, Mo? I know we've got some
Cindy, even
Cindy,
student. Yep.
Cindy on the home health issues, and we'll have to get Cindy back towards the end of the year as we get closer to the Oasis E, and even as we find out more about these proposed cuts and whatnot. But a lot of good content that we're trying to put out there for you guys. So
and
please.
Great content coming up too. So next week we have Dr. Todd Davenport. Hopefully the trolls will tune in as well too, so they could troll him on
let me
YouTube.
tell you, I'm definitely getting some popcorn for that one, because Todd's a good guy, man, and he let me tell you, I've learned to just sit and watch Todd. Like, I don't even engage with Todd. Like, it's just, he's on another level. He's like probably like Steph Curry dropping threes from the middle of the court, and everybody else just trying to keep up with him, man. You can't keep up with that, man. So definitely looking forward to having him on next week.
Yep. So continue to tune in. We appreciate y'all. All right. Have a good night. Peace.